You are live.
Welcome to Dr. Dekel's Sunday Live Show.
Hello.
This is Dr. Dekel.
How you doing?
Welcome. So today we're going to be talking about a very
Apropos subject.
Exactly.
Hair loss.
Yes, which actually
How many women, how many men need to address this issue?
Absolutely. And then remember how bad mine was?
Yes, I do.
Yes, like I've not been able to actually get hair growth past about, I think, my shoulder right below until Dr. Dekel started doing treatments on me. And so for my hair being as long as it is, would have never happened. So you are my
thank you.
You're my hair whisperer.
Thank you.
Okay. So moving on. So we do have a new treatment that we're actually introducing to the clinic. Thank you.
That's nice.
Very sweet. Watch, is he going to
creepily
do it?
Oh my God, what service with a smile.
On that side. Mm-hmm.
There we go. Never have enough water as it is.
Right, exactly. Right. Cheers. So we're going to be speaking about hair restoration and then also newer. I mean, we've already introduced the service. We've already done it on multiple patients, seen great results. But it's something that we haven't really spoken about on live yet.
That's correct.
So it's something we want to speak about because your scalp health, which I didn't realize until I was losing my hair like crazy after COVID, just like I've heard from everybody else, men, women, everybody, is the fact that it's just as important as washing your face every single night. Your scalp health, and a lot of times there's a couple foes that you'll hear from different people, dry shampoo. Dry shampoo is awful. That's just basically clogging up the follicles in your hair, and it's not basically letting it breathe, letting it do its thing naturally, and letting it go through the phases that it's supposed to. In fact, it keeps you in a telogen phase, which is essentially where your hair is falling out. So stay far away from dry shampoo. And then also there was a phase a couple years ago where they said you should only wash your hair twice a week. That's not true. If you can wash your hair every single day to get the grime and to get the scalp out, or not to get you want to keep your scalp, but to get all of the gunk out of your scalp, that's also going to be able to help you to be able to get your hair growth back in sync. And then also do not take a ton of zinc, because that's something else somebody did or a lot of people did after COVID, which did cause quite a bit of hair loss. Is that true with zinc?
Yeah, not only that, but the extra amount of zinc, actually a small amount of zinc helps the prostate. Too much zinc doesn't help it. So it's another little point.
Okay, yeah, because I had like 6 friends that during COVID and then after COVID, they were popping high milligrams of zinc, and then they started seeing their hair slowly fall out. So I think they should stay away from that. Okay, so what is the hydrofacial Keravive? So basically, and I'll read it out for you. It is a healthy scalp, it says a healthy scalp is the foundation for healthy hair. Hydrofacial Keravive is a unique, relaxing treatment designed to cleanse, stimulate, nourish, and hydrate your scalp for fuller and healthier looking hair. And this is kind of the 3 steps that you're going to be doing that's going to basically revive your hair, help the growth, and then give your stimulant to continue to grow longer, thicker, fuller hair altogether, on top of this MD right here, who will come in with the platinum package. But this is the
premium. Can't wait for that.
Well, exactly. Well, this is the premium. So basically, you're going to do a cleanse and exfoliate, which is what myself I would be doing to your scalp. So we would use the hydrofacial vortex technology to extract dirt, oil, and impurities from the scalp and the hair follicles while stimulating circulation, which is like a huge thing. Stimulating circulation is everything when it comes to scalp health. Step 2 is going to be stimulate and nourish. So after we've exfoliated and got everything out of your scalp, which is actually a very interesting tool on a side note, is we have, and again, you may kill me, it's not a stethoscope, but it's a live microscope that we put into your scalp, and you can actually see all the grime and dirt. Even though your hair is washed and you're coming in, you're like, it must be perfect. We can actually show you the residue that's left behind that's basically holding that follicle back from being able to grow. And this is what makes this treatment top the line like nothing else. So again, stimulate and nourish, which is going to be in office. So we take the Hydrofacial Keravive Scalp Health Solution Delivery Method, which is a proprietary blend of growth factors and skin proteins, and it stimulates the scalp, and that's what nourishes it after cleansing. And then we give you an at-home treatment, which is honestly the most important part, is that you use that on a daily basis. If you're using that on a daily basis, then it's going to help your hair grow in between your next treatment of coming in for another hydrofacial. You're going to be doing a treatment again of 3. With that, we had a couple questions, which is, does Keravive work on hair loss? Obviously it does, because we're talking about it, but I will kind of give you a little bit more of an answer. Keravive has been shown to improve scalp circulation. It stops hair thinning and encourages the growth of thicker hair in both men and women. It has platelet-rich plasma, PRP, which is a concentrated of plasma protein that is effective in stimulating the body's natural healing response. So it's kind of almost taking not necessarily what we would call like the old school, because PRP works, because I did PRP just on my own hair without incorporating Keravive just until recently. But again, you're not going to see the results on this because I just did it. And the PRP itself made my hair extremely full. So what Keravive did was they took the idea of what Dr. Dekel's been doing for over 10 years, and they put that into their formula with different proteins and peptides to be able to give you that delivery method. So if you're extremely afraid of needles, if you don't like getting pricked, this may be a good way to start your process to see if you can get some hair regrowth before going a little bit more in depth into doing a full PRP with Dr. Dekel. And Dr. Dekel, would you like to kind of explain your super sneaky PRP process, or how much you would like to disclose of your super sneaky PRP process?
Excellent. First of all, congratulations. Great presentation. It was very hard for me to keep quiet, but I didn't have anything to say. I mean, I couldn't say it better than her, and that's her expertise. What's my expertise?
Everything.
Well, yeah, but we're talking about hair loss at this point. So I'd like to start with the basics of hair. Okay, so we're talking about the external, all the beautiful chemistry that we have here, natural as it is. But I take care of also what actually causes hair loss, especially in women. Well, man, I'm bald, I'm happy, I have no problem with that. But women losing hair is a major issue. Okay, we see it on a regular basis. And women don't have male pattern baldness. Okay, then why would you lose hair? Well, a lot of it has to do with the inner working of your system, mainly thyroid.
Yeah.
Thyroid is absolutely essential for you not losing your hair. And a lot of us walking around with suboptimal thyroid function, and we don't even know it, because if you go to a conventional doctor, they may do the blood test, etc., and they say, you're perfect. You're perfect. Well, the thing is, the numbers look good, but obviously comes with it in that territory is what? Not enough energy, okay? The fact that you have brain fog, cold feet, cold hands, irregular menses, infertility, and on and on and on. On top of that, we also have a gland called the adrenals. The adrenals are the gland that are responsible for stress response. They work together with the thyroid. And even if you have a thyroid condition and you take a medication and you feel more or less okay, if nobody's taking care of your adrenal, believe me, you're not being taken care of correctly. No. So that's number one. So we look at what's going on. We look at inflammation, okay? Inflammation is not conducive to hair growth, okay? Inflammation starts where? Inflammation starts in the gut. So we'll review your health in general, your lifestyle, and give you also the basics that we need to support the hair growth that we're going to stimulate with the latest of latest. And let's go now to the PRP. What it stands for is platelet that are being derived from your own plasma. Okay, uh, platelets are part of the plasma. Okay, and they're responsible for clotting.
Yeah.
But it's interesting to say that platelets also have the capacity or the uh, growth factors that are actually stimulating the hair growth. So it's a procedure. We take about 30, 40 cc of blood, venous blood. We spin it down in a specific way, and we separate the rich plasma portion of platelets. And then we are activating it, and we are going to inject it into the scalp, the areas that needs to be injected. You referred to a little bit of pain.
Yeah.
Nobody likes pain.
No.
Okay, so what we do is we actually numb the skull. You know, the nerves go from here to the back.
It's
So if
comfortable.
we are using a numbing agent around here, and it gives you a pretty much, I would say, an informal ability to reduce the pain to very little.
With Pronox too.
Yes.
Yeah.
Thank you for reminding me of that. And we do have a Pronox device that actually gives us kind of what we call sweet air that
Just
dentists give us.
relax.
Okay, but it's a more sophisticated device, and this is really a voluntary. In
Yeah.
other words, if you feel pain, you take a puff.
Yeah, you really honestly don't need it. We just kind of have it beside in case you're a little bit more sensitive, and that's fine. You know, some people's scalps are more sensitive than others, and it's a good device to have around.
Yeah.
It's almost like having laughing gas at the dentist, but it wears off within 5 minutes.
Because pain is very subjective. Some people can deal with it better than others. So again, the idea is to be painless and very effective. So what we do is we are injecting as needed, when needed, and the best thing to do, really, that's my advice. Everybody's a little different. So there's no one shoe fits all.
Yeah.
So what we suggest is what? Come in.
Yeah.
15-minute free consultation with me, with my director of aesthetics here,
Yes.
knows everything that there is about aesthetics. And by the time you finish, you're going to know, number one, what's going on. Number two, what is the plan of action? And number three, the only thing you need to do is what? Decide which direction you want to go.
Yeah.
Okay. Usually, you need to take into consideration that PRP, if we go that route, actually are a series of 3 treatments,
Yeah.
a month apart, and the success rate is about 80% significant improvement. So these are the numbers. So now I'm going to move it back to my director here to close the conversation.
Oh, I actually did have a question for you.
Yes.
So you know how I've been kind of seeing a little bit online, they're saying that, you know, the PRP is only as good as the platelet-rich plasma that's within your body. So say if somebody isn't taking care of themselves and you're pulling an IV, are they giving the best PRP or the platelet-rich plasma to inject into their hairline? Or do you need to honestly kind of go through Dr. Dekel's plan, you know, getting the gut right, getting your health right before you go into doing the hair treatments?
That's a very good question. That refers back to my initial statement. We need to fix the inside in addition to the outside. So yeah, it makes a lot of sense that in order for us to be in good ability to regenerate, of course, we need to have the energy, we need to have a certain lifestyle, a certain diet, a certain ability to have a gut that is not inflamed.
Yeah.
So all of these are playing into this, and I believe that's one of the main reasons we have a good success record, because we're just not coming in, have an injection, have a nice day.
Yeah, exactly.
We actually explain to you what you need to do in order to achieve your goals, not just for the hair. Because if hair is something you can see, how many things you cannot see
Yeah.
that's
It's a big
happening in
thing.
our body? In other words, how fast are we aging? Okay, what kind of health level, for lack of better words, do we
Yeah.
have? Is it easier to get a cold in the winter? Any shingles? Anything that shows us what? Lesser ability of the immune system to protect us.
Yeah.
So yeah, it's a very good question, and the answer is yes. We need to rebuild the foundation.
And if a patient comes in and they're not having the highest quality of health, and you kind of get them on track for at least a month, then maybe that's something we can go, hey, once your PRP is at a point to where we can do that, But until then, if Dr. Dekel, gives the sign off for it, we can use CeraVive because they are using what is almost mimicking PRP to get that into your hair, while at the same time you're working on your gut health with Dr. Dekel. So you basically go down the hallway and see Dekel, and then come down the other hallway and see me with the approval of Dr. Moshe Dekel over here.
Wonderful.
Wonderful. All right, so moving on to the next. So I did have some people ask about what is in the peptide booster. That kind of is a good point to lead us into. So right now they have a proprietary, if I can speak today, serum that consists of Hydrofacial's patent Vortex technology and CeraVive peptide complex with skin proteins, growth factors, and special ingredients as EGF, VEGF, BFGF, and beta-4. And tomorrow I'll be doing a live cast out of the aesthetic room, and we'll break those down so that you can have a little bit more of an idea as far as what that is, what that means, and the different phases of your hair follicle, things like that.
What time tomorrow?
So tomorrow we're going to be doing it at 9 a.m.
That's very nice. And how can they find you?
Well, they can find me here, obviously.
Okay. So what else they need to do as far as liking us?
Liking, subscribe, all that stuff. I do have a few more things. I'm going to steal a little bit more of your Sunday.
We did enough for today. Let's close the deal.
I have 2 things.
We had enough.
Okay, fine. Tomorrow I will go in more depth.
Okay, what else do they need to do? Like us? What else?
Like, subscribe, share, just like us like crazy.
The bell.
Hit that like button, hit the bell button, be our friend. We want to be your friend. We want to get to know you. You want to get to know
everybody.
him. He's amazing.
Have a nice night.
Absolutely.
Thank you.
Wow, we love you guys.
Oh my God, you're great.
So terrible.